There is a ray of hope tonight for the sufferers of a painful, debilitating and under-recognised condition that affects tens of thousands of women. Clinical trials are being launched for a potential new treatment for endometriosis, which, if successful, would be the first for the condition in 40 years. Our Scotland reporter Louise Scott has more.
27-year-old Katie Johnston has a successful career as a radio presenter. Today, she's hosting an International Women's Day event. But behind the smiles is a more than decade-long battle with the debilitating disease, endometriosis.
Agonising menstrual cramps, really heavy bleeding, fatigue. I was passing out and waking up in hospital and needed morphine to get through a period. I could barely make it out the door. I've done 2 rounds of artificial menopause. My bowel and my bladder are fused to my uterus, and I'm still at the back of the queue for whatever solution is going to be presented to me next. Like, it's a lifelong, life-altering condition.
The disease sabotages the normal menstrual cycle, where the lining of the womb builds up over the course of a month, leading to a period. But in endometriosis patients, similar tissue grows elsewhere in the body, like the ovaries, bowel and bladder. It leaves the women who have it suffering from severe pain, heavy bleeding, inflammation and can in some cases cause infertility. Researchers have now discovered a potential treatment that's historically been used to treat metabolic disorders in children.
We identified in the laboratory that the patients with endometriosis had much higher levels of lactate. So we then looked for drugs that we knew were already in the market that could be used to reduce levels of lactate. And then in our laboratory models of endometriosis, we exposed those cells to this drug, which is called dichloroacetate. And that's where we found that it shrunk the lesions and it reduced the levels of lactate.
If the clinical trials are successful, it will be the first new treatment for the disease in 40 years. Katie is making the most of days where she isn't experiencing a flare-up, but she's hoping this potential new treatment will allow her one day to live a pain-free life. Louise Scott, ITV News.